Good day, everyone, and welcome to yet another WAS webinar. Today, we are joined by our professional Education in Sexology Committee, or the PES Committee, and they are going to be reflecting on professional education in sexology. That is the theme for today. So let me just remind you of what WAS is and what we do. WAS is the professional home for all those who work in sexual health and rights, all professionals who work in sexual health and rights. And that includes a massive array of role players. So we have doctors and psychologists, and you will see some of our panelists today. We have educators, we have advocates, we have psychiatrists, we have urologists and gynecologists, all sharing the same work in sexual health and rights. So today we will be focusing very specifically on professional education in sexology. Before we begin, I would like to just remind you that I'm Renee de Klerk and I am the Executive Director of WAS, and it is an honor and a privilege to work for such a wonderful organization. I also would like to remind you that please tell us where you are from. Today I am speaking from South Africa, which is my home country, and please engage in the chat and tell us where you are joining us from. I'm also going to quickly read to you our house rules for our webinars. It's a little bit of a list, so just bear with me. Please note that the webinar covers sexual health topics, so please confirm that you are 18 and older. The views shared today are those of the speakers and may not necessarily reflect the official position of WAS. We follow the WAS Sexual Rights Declaration. Our information is evidence-based, inclusive, and culturally sensitive. Captions are available and live translation is available in multiple languages. So please just select your preferred language using the interpretation button at the bottom of your screen. And of course, we encourage engagement. Use the Q&A box for questions and the chat for the general discussion. We'll try to answer as many as possible of the questions we receive during the duration of the webinar, and we'll get to that at the end in the Q&A session. WAS promotes informed, healthy, and positive sexual behaviors for all. A recording of this session will also be made available through our newsletter in a week from now, and please consider to join WAS as a member. I am now going to introduce you to the host for today, my dear colleague Stefano Eleutheri from Italy. He is an Associate Secretary of WAS and he serves on the Executive Committee. He's been a long-serving volunteer member of our Advisory Committee, and we love working with Stefano. Thank you for being here today, Stefano.
And thanks everyone for being here. It is my pleasure to introduce our first esteemed speaker for today, Elsa Almas. She's a specialist in clinical sexology in NACS. She started the program in sexological counseling at the University of Agder in 2001 until 2021, and she's professor in sexology from 2012, becoming professor emerit in 2021. She's clinical black psychologist and sexologist from 1987, and now she's chair of WAS Committee for Professional Education in Clinical Sexology. She will talk about the importance of professional education in sexology in advancing sexual health and well-being globally. Thank you, Elsa.
Thank you. I'm going to take you through this very long title of this presentation, The Importance of Professional Education in Clinical Sexology for Sexual Health and Well-being Globally. This is a result of up to now 8 years of work in this committee, and I must say that it has been amazing to experience how easy it is to work together with people from all over the world. We can reach agreements, we have good discussions, and I think that the basis for this is that we have sexology as a common profession that we can lean on. So let's just start. I have to push the right button, that's always correct, always important. Okay, the importance of professional education in clinical sexology for sexual health and well-being globally. Sexuality is a universal motivational factor, modified by political, economic, social, cultural, and religious factors. And basically, every human being worldwide has the same interest in getting professional assistance when sexuality fails. And the importance of professional education, we can take a closer look at. If I can get it must be evidence-based. Together with clinical work, also our education must be based on the best available research evidence, based on clinical expertise and patient characteristics. This has been described by American Psychological Association Presidential Task Force on Evidence-Based Practice in 2006, and it is described. It is listed in the reference list. Let me see. And what is professional in professional sexology? Sexology can be a profession on its own, or sexology can be a specialization based on other professions. There are pros and cons for both alternatives, but I think that for us now, it's easiest to work with sexology as a specialization. But it would be very, very nice if it could be a profession in its own in the long run. The importance of professional education in clinical sexology for sexual health and well-being globally. Sexological education can be divided into different areas, like sexuality education for teachers, public sexual health for politicians and sexual health planners, like primary prevention, and then clinical sexology for healthcare professionals, which we are going to talk about today. And clinical sexology, let's take a closer look at that. This is, of course, something that we have to discuss, but I have suggested that we divide clinical sexology into different areas. Basic sexology, sexological counseling, sex therapy, psychosexual therapy, and then medical sexology and sexual medicine. I say a few words about each of these. Basic sexology is basic for all training, and it has to do with anatomy and physiology, psychological development, and social cultural factors. You may see that this is the biopsychosocial approach, which is very dominant in sexology. Sexological counseling is the first clinical part, and it has to do with an analysis of the problem. And the sexology part is very important to be able to understand a sexual problem. Then we have to look at the counseling methods. That is important in order to meet the problems. And then it is important to prevent escalation of problems in secondary prevention, and when and how to refer to more specialized expertise. The next level is sex therapy. This addresses common sexual problems, sexual dysfunctions, or sexual, and it's using sexological treatment methods like sensate, focus, start-stop, masturbation training, etc. Then we have psychosexual therapy, which has been introduced quite recently. It has to do with, it's based on education in psychotherapy, psychology, or psychiatry. And it addresses sexual problems related to psychological or psychiatric conditions. While counseling and sex therapy focus on the presenting problem, in psychosexual therapy, we all often have to do an analysis of how the problem has developed and how we can work more deeply with these problems. Medical sexology and sexual medicine. These concepts are used mostly interchangeably, but I like the suggestion of Woodganotton a few years ago to say that medical sexology address sexual problems occurring in a medical context, while sexual medicine focus on medical treatment, medicines, surgery, blood tests, etc. And it is practiced by medical doctors, nurses, and other paramedical professions. The importance of professional education in clinical sexology for sexual health and well-being globally is also based on the understanding of sexual health. And this definition, I think we all know, sexual health is integration of the somatic, emotional, intellectual, and social aspects of sexual being in ways that are positively enriching and that enhance personality, communication, and love. And then sexual health enhances sexual health and well-being. And I think that is one very, very important reason why sexology should be introduced more widely in the general health system. And also that it prevents sexual and other problems. And untreated sexual complication gradually spiral into destructive feelings of shame, guilt, relational misunderstandings. And the definition of sexual health is an ongoing process, as described by Edwards and Coleman in 2004. Let me see. The text is hidden for me here, but perhaps you can see that the studies have shown that the right to sexual and reproductive health is still not guaranteed in a new publication from Portugal in 2024. So what does globally mean? We have already said a little about it. That sexuality represents universal individual needs for love, intimacy, trust, self-esteem, independent of culture and religion. It concerns everybody. And sexology is also represented in all parts and most countries. Sexology as a profession is also represented in all parts of and most countries in the world. There are some identifiable gaps. One is very important, and it is that sexology is a topic that basically is not taught in any undergraduate health education program. It has been described by Kontula, Mullen, and WHO in 1975 already. A little about the results from the global survey that the other presenters will say a little more about. We find that worldwide there is a diversity of programs. At universities, we see master degrees and shorter programs at master level, and as continuing education by professional organizations outside university. It addresses different professions like medical doctors, psychologists, psychotherapists, nurses, physiotherapists, social workers, teachers, and others. But sexology is not recognized as a profession or a specialty by the governments in most countries that have been studied. So this is some conclusion, but it's not the end. Sexology must be recognized as a profession or a specialty on governmental level. Sexology training and education must be welcomed in different formats and of different scope. International guidelines have to be developed for approval and certification of educational program, short courses, as well as for supervision. Such guidelines can be organized as a Lego model, where programs must fit into a superior plan. Most people know Lego as a toy, I guess, but this plan must address all problems that people can need professional help for and define knowledge on different levels for different clinical tasks. And an example of the Lego model can be the original NOX education. NOX is Northern Association for Clinical Sexology model, and accreditation, I think, for specialization in sexology. I cannot see the text now, but this is the Nordic model, and it's not a brick; it's a bunch of bricks. It is basic psychology education, and here is a basic medical education, and here is a basic education in nursing or other bachelor programs in health. And on top of this, we can put sexology education, supervision and practice, and in the Nordic model, you will then become a specialist in sexological counseling. But then we can add also to psychology education and medical education, sexology education, and supervision and practice. And then we will have a specialist in sexological counseling here too, but and add other academic or clinical training to it. It's hanging, yes. Sexology training, including supervision and practice. And then we will have, I was told it could take a second or two before they come up. It's in clinical sexology. It's coming slowly, but it's coming. Okay, and then we shall look a little more at the details here, how we can build this. It's very slow. We're going further. What are the Lego bricks? 1-year study at universities in Europe is 60 ECTS, according to the Bologna model, which is a model for all universities in Europe. This corresponds to 1,600 hours divided into 400 hours lectures by teacher, 400 group work, and 400 individual work reading literature. And then the 400 lectures at universities can be divided into separate modules, like Lego bricks. University courses of 5, 7.5, 10, or 15 points can be given at different university and be combined into a tailor-made individual program. Very flexible if the universities can cooperate in this. Programs can also be developed outside universities. 1-day courses usually counted as 8 hours lecturing. 10 ECTS is about 65 to 70 hours lecturing, equivalent to 8 to 9 days course, 2 weeks or 4 and 5 days. It's coming. Group work, literature studies, clinical practice, and supervision must be in addition to this. And the last one is that accreditation must be able to include different ways to develop sexological competence. So these are my references, and what I've presented here is, of course, open for discussion and will be worked on in the committee for the next 4 years to come. So thank you. I hope I didn't.
Thanks a lot. Yes, thank you, dear Elsa. It was really interesting, your presentation. Now, it is my pleasure to introduce our next speaker for today. Dr. Leslie Lapinkar is an assistant professor in the Department of Psychiatry and Behavioral Sciences at Northwestern University in Chicago, where she serves as the director of the Sexual and Relationship Health Program and co-director of the Pride Center. She will talk about the WAS Professional Education in Sexology Committee goals for the term 2025-2029. Thank you, Leslie.
Yeah, absolutely. So happy to be here with everyone today. Can you all see my slides?
Yeah, perfect.
Excellent. Okay, so yes, I'm Lisa Lapinkar. I'll be talking about our committee goals, what we're doing next. So I'm the current chair of the Professional Education and Sexology Committee, and I wanted to start with giving a little bit of context about what we've been doing, giving a little bit more detail about kind of what the work has been so far to like show the progression of what we're hoping to do and how that links in with WAS's broader goals. So the PES committee was officially established as its own separate committee in 2021 with Elsa almost as the chair, and I served as the vice chair during that time. And so we started with inviting committee members and establishing goals for the term. And we did this in a very purposeful way. We worked really hard to ensure that we had representation from all the different world regions. It seemed vital to be able to really advance professional education to make sure that we were hearing the different perspectives from the different world regions. And when it came to the goals, our primary overarching goal was to understand what the state of professional education in sexology was in the different world regions and kind of broadly around the world in that way. And so we started with doing a literature review. And, we noticed that there were certainly some publications on this, but they were mostly focused regionally. There wasn't anything that was really looking worldwide, which was the way that we were hoping to approach it. And so we worked together collaboratively to develop a survey. Elsa referred to it in her talk, the Global Professional Education in Sexology, or GLOPES survey. And we did this collaboratively to ensure that the questions would be relevant to the different kinds of training that is available around the world. And then we used the WAS network as well as our own professional networks to distribute that survey. We did, and then we kind of did a preliminary analysis with our first round of data collection and presented the results in the WAS Congress in Antalya in 2023. And, after that, we were trying to figure out what we were going to do. We had all this information. We had been really immersed in what the state of professional education was around the world. And it felt like our original plan had been to publish an article, and it felt like we really had too much information for just that. And so we proposed a special issue with the International Journal for Sexual Health, and so once that was agreed to be once the editors there agreed to work with us in this way, we really got to work on kind of finalizing our analysis, both globally and regionally, and submitting papers. And so they're currently under review. We're hoping that'll be published next year. I'm not going to get into all the details of the results since, read the special issue. But as we were kind of doing this analysis and writing it up, we were really thinking through the implications for WAS of the work that we were doing and the challenges and opportunities that we were identifying in the state of professional education worldwide in sexology. And so as we were really reflecting, like Elsa was describing, right? Like a lot of what she presented in her talk are a lot of the kind of conclusions that we were coming to as we were immersing ourselves in this data. And it's too bad you didn't get to hear Osmar's talk before I gave mine, because I think he also will provide a really nice context of some of the things, a lot of the challenges that we're identifying. And so as I took over the chair position and we're thinking about what our goals were going to be for this upcoming year, our term, not just year, we were reflecting on what the WAS priorities are. And there were 3 that WAS really identifies as being where professional training and education and professional education in sexology are really integral. And so this includes advancing sexual health, rights, and justice, right? Promoting universal access to high quality sexual health services, and combating misinformation and censorship. So in all of these, professional training was specifically named as something that would be necessary to achieve these goals. And also in the theory of change that we as an advisory committee developed, one of kind of the idealistic things that we hope for our profession is that professional standards are well developed and regulated on ethical and best practice guidelines to ensure the highest quality of clinical and other sexual health services around the globe. And so as we were holding these things in mind to think about how, given what we know about professional education based on our work so far and what WAS priorities are, how we as a committee could further make progress and enhance professional education. And so our primary goals for this term are, first, creating these clinical sexology training guidelines. And I'll talk a little bit more about them, but at least creating a first draft of them. Also, developing a network of clinical sexology training programs, and going beyond just a directory, but actually a network. And again, I'll speak more to each of these. And finally, disseminating our work. We want to make sure that what we do is available to everyone. And so when we're thinking about these training guidelines that we want to develop, there is some kind of more foundational work that we need to do. We're being very thoughtful in this process. We're trying not to rush it. And so one of the things you'll notice in across speakers, and even probably within my own talk, is there's sometimes a interchange of using sexual health versus sexology as the word we use to describe our profession. And I think that's something that we'll need to grapple with a little bit. What is it? What is it that we are training on, and who is it that we are training? We want to make sure that we're not too broad, because that's not going to create that's not going to enable us to create something that's useful, but also not so narrow that the training guidelines are only applicable to a very few specific, highly educated, kind of like doctoral level sorts of training programs. We want it to be, like Elsa was describing, modular and applicable in a range of contexts. And so some of our other early work is going to be an in-depth review of some of the exemplar programs and curriculums in the different world regions. and conducting a SWOT analysis, identifying the strengths and weaknesses of those programs, as well as what opportunities there are to improve or to step into an unoccupied space, and what threats are there, like what gets in the way of us being able to advance this work. And like I was saying, like we're really looking for a modular set of guidelines, things that can be responsive to regional needs. We also really are looking forward to collaborating with the ethics committee through WAS, and including education on sexual rights and justice in these guidelines, in line with that WAS priority. We think that's vital to ensuring that folks who are being trained in sexology have that basis as part of their training. And we want to be kind of also advanced in the educational methods that we're using. We don't want to be behind the times. We want to be right at the front of the way that education is working. Okay. So this is the big one. This is the biggest work that we're going to be doing, I'd say, this year or this term. One of our other main goals, like I said, was this training program network. So we'll start with kind of a directory of training programs that completed the GLOPES survey, but that's just the first step. We really want to build a network through our professional connections and through working with the folks who already completed the survey to identify and include other sexology training programs. This is, in response, one of the things we really noticed is it seems like there's a lot of programs that are really siloed, that are not connected to each other. And if we can facilitate this exchange of resources and information and educational techniques, then there's going to be a lot less reinventing the wheel. There'll be a lot less of having to create things from scratch when there are other programs that exist that people can use. We want to increase access to training by enabling the implementation of high quality training programs around the world, and thus increase access to high quality sexual health care and services. Okay. All right. And then our last goal is disseminating the professional education products. So, we have this special issue that we're hoping to publish next year, and we are doing webinars. This is our first one, which I'm very excited to be part of and to be helping to organize. We're hoping to do another one in conjunction with the special issue. If folks are interested in other topics, let me know. I'm happy to help put things together. And we'll certainly be collaborating with the wonderful WAS media team, who have so many connections and so much knowledge about how to get information out, not just to other professionals and other professional educators, but that we reach a broad audience so that we don't keep this information kind of really restricted and only accessible to academia. And we see this as one of the ways that we're really combating the misinformation and censorship that we see coming up in our field. A kind of approach of countering what is out there with high quality, evidence-based, clinically informed, culturally responsive kinds of information and training. Okay, my talk was a little bit short, kind of in the interest of making sure everything runs smoothly and on time. So that's all for me today, but thank you so much for your attention and attendance.
Thanks a lot, Liesl. I'm sure that we will have opportunity to discuss better in the discussion the next goals. Okay, so last but not least, I will introduce Anthony Smith from South Africa. He's a family physician and sexual medicine practitioner in private practice in Cape Town. He holds a master's degree in family medicine and is currently serving as co-vice chair of the professional education in Sexology Committee of the World Association for Sexual Health. We'll discuss about opportunities and challenges in postgraduate medical sexology education, lessons from developing a postgraduate diploma in South Africa. Thanks a lot, Anthony.
Stefano, thank you. Thank you very much indeed. And it's good to be talking to all of you today. So in some respects, what I'm going to be covering is a bridge between the global and the local, and is going to be both a looking back and a looking forward, insofar as Elsa has very clearly and Liesl described where we've come, and we've got a really good looking coherent roadmap insofar as we're able to have in terms of where we're going. Our experience in South Africa is in developing a new postgraduate diploma, a clinical professional diploma specifically for doctors. And this development really was a very roundabout thing, which had to be adapted many times to the kinds of educational, political, professional types of realities and obstacles. And in this process, it was a real learning task. So while it's not necessarily that there are direct lessons, it's an interesting lens to look through, because certainly South Africa and the challenges and obstacles as well as the opportunities is a microcosm to what we encounter on a global level altogether. So let me go forward. So just to kind of, I'm going to cover a little bit of ground that was already been spoken about. And so far as looking back and understanding where we're coming from is really important to understand how we can go forward. We understand that the professional sexual health education is inadequate, it's inconsistent, it's fragmented. And even those programs which are accredited are not really fully integrated across the different medical components, across the biopsychosocial spectrum. So we're really needing to be able to get pathways which are able to be truly touching into the multidisciplinary aspect of the professional element of it, which includes being sure that we can get the right quality, we can get the right ethical depth, and that in addition to getting our clinicians adequately educated, that we're able to also prevent harm to our patients. So up to now, very specifically, we see that clinicians are lacking in clinical competencies. There are few formal scopes of practice, assessment tools which look at education, and the accreditation and regulatory pathways are not up to scratch. Sexual medicine, sexual health, you can see also the different ways in which I'm defining and using these terms, but nevertheless within medical environments is often cross-cutting in that it intersects with many of the different specialities, but it still remains peripheral. No discipline takes full ownership, and as a result, it isn't able to fully find its feet and be able to get to the point of a professionalism and authority which we are looking for it to have. Overall, no global body is defining standards for clinical sexual care. And while it's true that there are guidelines for individual dysfunctions, issues, problems, nevertheless, in terms of educational practice and guidelines, we are sorely lacking. So I'm just going to let me go back. Okay, so this matter is also something that we've to some degree spoken about already, but the importance of it is, as we know, the sexual health conditions are common, but our clinicians are lacking training. Our patients are facing stigma, misdiagnosis, unnecessary prescribing, and avoidable ethical violations. And increasingly, with NCDs, non-communicable diseases, and mental health issues becoming more prominent, so too are sexual health issues. Especially in countries like South Africa, similar countries, the workforce and training gaps are ever present and worsen inequality. So I'm going to take a slight side path for the meantime and look at the example of palliative care. Palliative care, one could argue, has existed a number of decades ago in the same place where sexual medicine, sexual health exists at the moment. Insofar as it really was a marginalized area, it wasn't integrated and prominent, and the emergence of palliative care was the result of a very specific strategic set of actions which were taken. Insofar as they very cleverly identified what the major population level needs were, suffering at the end of life. They were able to build a distinct body of knowledge and a competency framework. And this is a key word which we're going to come back to over and over again, that of a competency framework. And we're able to then take that and demonstrate measurable impact on the changes and the educational structures which they built, also aligning these with global rights frameworks. They scaled new service models. So what was innovative in the way that palliative care worked is that they didn't just kind of tack on what they were doing to other subsections within medical specialities, but they were able to formulate models that stood by themselves and were able to innovate around different aspects, different parts of the workforce, notably nurses, palliative care doctors, and various other integrated services, such that the identity of the subspeciality was able to grow and gain momentum. And of course, they're anchored in academia with professional bodies and academic structures. So a lot to learn, and studying palliative care is very illuminative in terms of seeing where we can go in terms of clinically professionalizing sexual medicine. Coming to the South African scenario, it's really a reflection on so many other places around the world, insofar as we have a high HIV and STI burden with 7.8 million South Africans affected by HIV, high level of gender-based violence with much social vulnerability. I've mentioned the increasing amount of NCDs and the workforce maldistribution resource inequity, also very, very important, with 16% of the population being served by 60% of the doctors. Also, young demographics, complex culturally and linguistically, 11 national languages with a great deal of social diversity. I think what I want to kind of highlight over here is, in fact, some aspects of the skeleton of the postgraduate diploma in sexual health. This was an initiative of the College of Family Physicians. Just to say a little bit more about it, it exists within the National Qualifications Framework at a level 8. This is just below a master's program or a speciality, a medical speciality, and just above a bachelor's speciality or a bachelor's degree. It's delivered by the college rather than an individual university, and we're talking really here about medical doctors for now anyway. The curriculum is aligned to 8 entrustable professional activities, and this is a core issue which is going to be very important, I think, for the PES Committee to be looking at. This is the frontier of medical education, where knowledge, curriculum frameworks are consolidated into domains which are formed on the capacity to trust a clinician to actually do something in a competent way. What we've done is we've taken the curriculum, we've divided into 8 different areas, and then put each of those made them as EPAs. And this concept of an EPA, for a variety of reasons, is an incredibly valuable one, which will be, I think, a useful one for the PES Committee to look into. So just the importance about any kind of professionalization is the authority upon which it rests. And this is just an example of what happens and what the diploma rests on, the three-pillar regulatory system in South Africa, insofar as there's the academic validity through government regulated qualifications, which define the level of educational attainment and the credit structure. This ensures academic rigor and quality assurance. And it also makes this qualification portable across institutions. The professional legitimacy is the Health Professions Council of South Africa, which confirms that training is within the medical scope of practice. It's the accountability of what doctors are doing, keeping them to the right ethical standards, and in doing so, protecting practitioners and, of course, patients as well. And then the nuts and bolts on the ground, whereby curricula, EPAs, the assessment system, this over here is all then taken by the various colleges, people who, and there are many different diplomas, all more or less to the same structure, which then ensures that the standards of the educational system are kept intact. So why could this be useful, and what are the important aspects of this which are worthwhile having a look at when we are looking at guidelines and global universal frameworks to deal with? First of all, the entrustable professional activities, which I've mentioned already. These are portable, they're measurable, they incorporate a biopsychosocial aspect, and they look at very specifically the competencies. It's a very, very practical way of looking at clinical work. Portfolio-based assessments, which are structured. These are ways of looking at clinical encounters, being able to capture knowledge, ethical reflection, and practice and procedural skills, and very valuable in environments where training resources are uneven. Similarly, remote OSCEs are going to work with limited supervisors, a problem which many countries globally are going to find. And this can protect the exam integrity and reduce dependency on the scarcity, on the very scarce specialists who are present in those particular countries. And then, very important and already alluded to by Liesl, is that issues such as ethics, the ethical behaviors, cultural humility can't be an add-on, it must be a built-in, and there must be ways of being able to assess this systematically. So the key challenges, just a few of them, which are important for us to be keeping in mind: scope of practice, also speaking to definitions, the modular training also alluded to, and particularly in diverse contexts, being able to cater for the fact that there is really a shortage of trained supervisors and assessors, and being able to support inequity. In South Africa, rural-urban inequities, but of course any kind of inequity. And then ensuring integrity, and this also brings up not only ethical issues, but that of AI governance, which we haven't mentioned yet today, but which is going to be increasingly important, not only to use as tools, but also to be able to utilize in ways whereby we can get good ways from distance without people, well, kind of leaning into AI and not getting the kinds of qualifications and expertise which we would be hoping they would be getting. So this over here will align with some of the committee's strategic priorities and some of the things which are going to be important. So excuse the repetition of some of the points that I'm going to go through here, but we want to define globally and culturally adaptable scopes of sexual health professional education, tiered training whereby we get a sense of what the difference between entry, generalist, and specialist, a continuum, the modular and specifically competency-based curricula, and also being able to ensure that there's context-sensitive and ethically robust designs. We want to standardize, which would include the OSCEs and the portfolios I've mentioned, and hopefully provide regulatory engagement and guidance. There are many innovative areas around the world, and it's going to be not challenging, but it's going to be very, very worthwhile to find out what those innovations are and to integrate those. Similarly, to endorse a global sexual health portfolio, and we've talked already about networks and guidance for AI governance. So I've kind of sped through that pretty quickly. A lot of it repetitions, but also of it looking forward to a landscape which gives really a great opportunity for us to stand back and look at a global, should I say, coherent, scalable way of being able to set standards and be able to truly influence the future of global sexual health.
Thanks a lot, Anthony, for your really interesting presentation, and it is always interesting to see the differences that we can have in different parts of the world, but also the commonalities that, of course, into the committee we will try to arrange. Please go, Osmar. Thank you.
Okay, next, please, and sorry for the interruption again. Next slide, please. We were talking about the brief history. Next one. And two more. We were talking about academic expansion and then the globalization and online era. And we have also non-university programs in Europe, like in Spain, France, Germany, Nordic countries, etc. In North America, in the United States and Canada, Mexico also, Latin America, in Mexico, Argentina, Colombia, Chile, Brazil, and in Africa and Asia. But these are starting or mainly given by NGOs or some institutions and private and some little courses, and we are starting there. Next, please. Unfortunately, there is not a worldwide directory of sexologist training programs. Next. And as in globalization and at the online era, we can say that at the end of the past century, we started with online short courses in sexual health. And from 5 years now, online becomes a standard for many programs, and after COVID, most sexology training goes online. But what about the quality of these programs? Of course, many of these programs have excellent or very good quality. But with a clear institutional framework, robust curriculum, evidence-based and interdisciplinary, practical clinical training supervised, professional competency development, structure and duration, ethical, legal, and professional standards, admission standards, assessment, evaluation, transparency and support, professional integration, and continuing development with WAS and with some other organizations for this. But we are not going to be talking about that. That's another talk. But somehow, some programs have low academic rigor, pseudoscientific content, poor supervision, and unethical practices. Non-scientific sexology training programs have issues in content. The content is outdated, incorrect, unscientific. Faculty are unqualified. Clinical preparation is insufficient and many times is absent. Ethics weak or missing. Academic rigor is minimal. Legal compliance ignored. Professional standards not aligned with international. Next. They produce practitioners who cannot safely or legally work in sexual health. Next. The master degrees and postgraduate courses they offer are either their own degrees or private professional certifications that they don't allow to be working or practicing in some countries. Some of these programs partner with universities that have achieved national or international accreditation and offer joint degrees, but the program, in fact, it is of low quality. and we can say that they buy those accreditations, and that's not good. There is not a list of their professors. When they are mentioned, they do not have recognized studies in sexology nor scientific publications, and sometimes students from those programs become the next professors. The sessions are generally recorded, and the student reviews them and takes exams only. There is not on live interaction with the professors. Sometimes they can have live sessions with guests. And I want to say here that in many times we are invited to give a lecture or a talk in these programs, and then they use those recognized professors to promote their programs. The practical exercises may consist of simulations or supervised case studies, but not really clinical supervised work. And then the students graduate receiving information, not training, with incorrect or outdated clinical knowledge, increasing the risk of harm to clients, cannot distinguish evidence from opinion, making them vulnerable to pseudoscience, are not competent to work clinically, even though the program advertises clinical ability. And I remember one of the programs that said, and the so-called sexual therapy may behave unethical, causing professional misconduct and patient harm. Confuse spiritual practices with evidence-based therapy. May believe that they are officially certified or licensed when they are not. There is a big problem with the commercialization and diploma mills, programs that exist only to sell diplomas. I could see in some institutions that they have like 200 master degrees, but mostly in business administration or some other things, and not sexological institutions. Automatic admissions, no prerequisites, not requirements. Sometimes they admit architects, librarians, and some other professions that are not related to sexology. Faster track master degrees, 3 to 6 months master degrees. I even have seen doctoral degrees in 4 months. Can you imagine? Certificates with no academic foundation, but they have aggressive marketing, become a sex therapist in 4 weeks. And you can find them in social networks. And if you look through the internet, there are like the first pages are this kind of institutions. And I can say that there is many online programs now. Europe, Spain has many online programs in Latin America, North America, and other in Australia, Asia. But next. Spain accounts for more than half of the world's supply of online programs in sexology, and they go through all the continents promoting this. Then here are some references of studies or talking about the quality of sexological training. And let me tell you that at the professional Education and Sexology Committee of WAS. We are working on that since the last administration. And as Liesl said, we are going to try to change this and to have better quality educational programs in sexology. Thank you very much, and sorry.
Thanks a lot, Osmar. We are happy that we were able to listen you. So now we have some time to discuss, and we have different questions. So I'm sure that our panelists will continue to give us a lot of interesting information. So the first question that we have that arrived when Elsa was talking, but I'm sure that also the other can help in replying, is asking, how do we fully practice and enjoy sexual wellness and well-being? I think the question was always in the dynamic of training. So, Elsa, if you want to start, and then maybe also the
Could we have the
others.
question in writing, because it's
Yes.
a bit.
How do you fully practice and enjoy sexual wellness or well-being? This is the question.
Well, that is a really, really big question, and I don't think that is actually the issue for the talk we're having today, because that is what we discuss in the therapy room, and we use a lot of time for that, and of course that is individual. So it takes a lot of time to explore the question before we can answer, I would say. What will my colleagues say?
Yeah, I mean, I agree. I think, right, like, how do you fully enjoy? I'm like, well, depends on who you are and what you enjoy, right? And so, I think if that's a question that you find coming up for you as you're listening to our presentation today, you might consider finding a psychosexologist to go and talk about this question in more depth and in a more personal way.
If I could just add to
Anthony?
that, just to extrapolate from that question and maybe it applied to educational structures. I mean, it does actually bring up quite an interesting point about what you're teaching clinicians, and moving away, and this I think addresses some of the other questions as well, from a more pathological orientated approach of being able to address sexual problems and being able to also emphasize wellness, pleasure, and using that as a foundational element of what it is you're trying to achieve in what you're looking to demonstrate and inculcate in your sexual health physicians. And excuse me, I'm just talking about the medical side of things. But so there is in that question, I think, a very important lesson for those who've got sexual medicine postgraduate education in mind.
Thanks a lot, Anthony. That also replied to the question from Nina Pardo, no, about how to avoid pathologizing. So let's go to the next question from Francisco Viola. He's saying there is a problem with sex education, sexual health training. Some is organized or supported by academic and scientific interest, while other training often stems from economic considerations. This latter type is relatively common in less structured settings. Is this issue being addressed? I think maybe Liesl can start replying this topic since she's the chair of the committee, and then maybe Osmar and the other can add something. Thank you.
Yeah, I think Osmar spoke really nicely to this question in his talk. And we're in full agreement that this is a major concern, where the program exists more for financial gain rather than to provide quality education. And that is one of the motivating factors for the work that we're doing, so that WAS can potentially say, this is a program that is not meeting the basic requirements that we have identified. It is not following these guidelines that we think are necessary in order to have somebody have adequate education as a professional and be able to provide sexual health services. But yeah, it's a problem. Osmar, would you like to add?
Yes, we have seen several private institutions this commercial training that you have to pass every student, because that means money to the institution. You cannot put a bad grade for that. And listen, that to avoid this, as we can do in WAS, is to have at least a directory of good programs, good quality programs, as we are going to be working on that, to have a directory, and then people can look for them. And that's my thinking. Thank you.
Perfect.
If I could also just add, I think one of the issues is really to be able to guide and provide some level of standard for engaging with authoritative committees, with the government, and with being able to really strengthen the regulatory side. Because by definition, then all the fly-by-night commercial ventures will fall away, because it'll become increasingly clear that they are just flotsam and jetsam, whilst you have really very solid core programs. So I think part of the job may be in helping to make those connections with the regulatory structures which exist within the framework of the particular countries, everything being different. It's a huge ask, but nevertheless, probably incredibly important to be able to kind of pare things down, simplify, and really get something authoritative.
Thanks.
I also think, I think it's a good idea what Anthony did to describe a very practical criteria and a model in South Africa. And we are doing some of the similar in Norway, where we want to develop curricula, guidelines for supervision, and guideline for practice, and also the format, and do it in a very practical, down-to-earth way, and have it test fit to do that. So I think that this is a huge challenge for us to describe those criteria that we need to know why and how a program is really good. But I think that to do that locally and then take it in to the global perspective, I see what can we get out of it, because then it will not be so theoretical, it will not be so abstract. So to test it out locally, I think is a very good thing.
Yes, thank you, Elsa. So let's go with Allegra Kremb, that is asking, could the committee please address and include the affordability of sexology educational programs as part of its work? I don't know who of you wants to reply to this issue.
Does that mean that they ask how expensive it is to take a sexology education?
Yes, I think they are asking if we can do something to maybe find some prices that are good for us. I don't know.
So I think one of the things that this brings to mind for me, right, like coming from the US context, the only way to really get professional education is to have at least a master's level degree, and then take additional and pay for additional coursework in sexology and like sexual health training. And the cost is large. Like that is all out of pocket. There are not really scholarships or grants available for that. And so I think one of the reasons that we're talking about this modular approach is to enable entry points at lower levels of education, for it not to be required to have graduate level degrees, but to make it accessible at a bachelor's level more consistently around the world. But that's speaking from the US context. I'd love to hear other people's perspectives as well.
Yes.
I mean, it's from a low and middle income country perspective, it's absolutely essential to make these programs affordable. And I think it's there where scalable, remote, technology-driven, and kind of guideline-informed, obviously evidence-informed type of programs are going to be increasingly important. Flying supervisors and experts to different areas over large territories is just not going to work at all. So in fact, there's an obligation almost to be able to try as hard as one can to bring it down. And I think in the next number of years, there's going to be a lot of innovation around education, which can be harnessed. And I think which also is going to need to be looked into, because things are moving so quickly in the educational realm that we really got to take advantage of that. So hard to really say. I mean, I think there is anything that's valuable is going to probably involve some degree of cost. I don't think you can eradicate cost altogether, but you've got to limit cost. So I think this is going to be a very important thing for us to look at, and maybe even speaking to people in AI, in technological aspects of education, is going to be quite useful for us to also engage with in the next number of years.
Also, I want to say that, for example, Pan American Health Organization, they already have a course of continuing education for physicians, and it is for free. And that is a very good course. But as Liesl said, that to have more practical work or clinical work, you have to go to some other kind of preparation.
Yeah, I think in Norway, the cheapest way to get an education is to get into a course at university, because the university program is in principle free or cost very, very, very little. But as we see in Norway, we have a course that can allow 46 students, and we have about 600-700 applicants. So it's far too little. So we need to have the politicians encourage universities to set up more courses. But of course, then we also have to take care of the quality and see that they have qualified faculty.
Perfect. Thank you, Elsa and all. Now I have a long and difficult question for you. So, what can we do to systematically identify bias in our prior understandings of sexuality and ensure that sexology educational programming is based on current information rather than prior paradigms based on societal biases? It is long, but this is the first important question that I think is really interesting.
I would say that the cooperation we have in WAS is very, very important, because we have the discussions and like the PES committee, we can discuss ideas, we can exchange experiences, and I think we always develop our ideas together. So I think to have a professional community is very important, both locally and globally.
I would add that including people at multiple levels of kind of professional level, right? Like people who are more senior in their careers, trainees, people in mid-career, right? Like folks currently in training are gonna be more up to date on literature a lot of the time than those of us who have been kind of in our practice for an extended period. And so I think not just like having different perspectives from around the world, having different perspectives from different disciplines, as well as having different perspectives in terms of what career level we're at, all helps to ensure that we're staying current and we're considering the way that the context that we as individuals live in might be biasing our thinking.
Okay, thank you. So we have still 3 questions, so maybe we can try to reply rapidly. Aline asks if you can please elaborate further into the challenges of building a competence framework considering the multidisciplinarity in sexual health.
Perhaps I can address that or start off with that in terms of the competencies. It is difficult because within professional environments, we often are trained in silos, and there's the tendency towards hyper specialization. Ironically, actually separates you from other areas of practice which would complement you, but which then become increasingly siloed themselves. So the very trajectory of how specialization works in itself, unfortunately, mitigates against the ease of doing this. But one way is to kind of come back to those EPAs that I talked about. And the thing about the EPAs, which is quite interesting, is that they're not looking at like a curriculum where you're going to just address a problem such as male or female sexual dysfunction. You are looking at you're looking at a very, very broad way of looking at solving a problem in a clinical setting. So it's not, and that's where the EPAs are quite useful. And when you think about any problem that you're looking at as a challenge in a clinical setting and what you practically are going to do about it, it becomes much easier to incorporate a multidisciplinary way of thinking about things. And in fact, it also is much easier to incorporate ways of thinking about bias and approaches and issues of consciousness, you could call it, and self-reflection. So this multimodal way of looking at a problem, as opposed to the kind of more pathologizing way of thinking around male sexual dysfunction, has an etiology, it has a pathophysiology, it has a management. That's the traditional way that medics are going to be. But being able to then sensitize and allow people to understand that the solutions to your problem by definition require the engagement with other professionals as a norm. And then you're building up sexual medicine as a kind of then we saw this in palliative care was the subject that an essentially multidisciplinary environment where your meetings are all multidisciplinary. In fact, it was, yes, all the global sexual medicine kind of committee associations do model this as well. So it's an interesting question, and it is a challenge, and I think one that is continuing to be a challenge, will always be a challenge, but needs to be mitigated against.
Anthony. So now another difficult question asked by Sumaya: how to identify a good accredited program in clinical sexology?
I didn't get the.
This is a difficult one.
Can you read it again, because I didn't get your pronunciation, I think.
Sorry. How we can recognize an accredited and valid course in clinical sexology?
I think it should be accredited and validated by some authority. That could be the sexological organization nationally, regionally, and also internationally. So I think that is the work that the PES committee has to do to establish such criteria. Liesl?
Yes.
Mm-hmm.
Yeah, I agree. I think, a lot of, and it depends on where you are. Some places there are more accrediting kinds of mechanisms. But I think also affiliated with a university rather than a private institution is one way. You also might identify maybe through WAS leaders in the field in your region and ask them for advice. I think one of the ways to ensure you're getting good training is to talk to people who who have done it and are doing good work and can give you kind of specific recommendations for where you live in your context.
Yes.
But I also think that Osmar is doing a fantastic job in identifying non-credible programs, and I think you should write some kind of guidelines about what to look up for.
Well, I have found some of them, but I think it is a hard work to establish and not to go for the bad programs, to go to the good programs and to promote them. And one of the things is that we have WAS as an international organization, but also we have regional federations and national organizations. And as Liesl said, that the program is linked to a university, but also in some countries, universities are not taking care of this issue. Then, but some sexological associations, good sexological associations, could offer this kind of programs also.
Thank you. So we just have 30 seconds, so I think we can go to the conclusion. There is also another question that was interesting about the incorporation of asexuality into WAS training, but it is a specific issue that, of course, can be better discussed by email with the speakers if you like. So I'm going to conclude now the session. I want to remind everyone that a reply of this session will be shared in the WAS newsletter. So you can sign up in the link that will be put in the chat now. I want also to remind that our next webinar is on December 9th. So be sure to register, and you can follow us as WAS on social media for updates and resources in the Facebook page was.org, or on Instagram was World Sexual Health, or on LinkedIn World Association for Sexual Health. I thank again the panelists. It was really wonderful to stay with you for this time, and hope to see you all soon again. Bye-bye. Thanks to all.